Hello and welcome to the Edmonton Bone and Joint Center's virtual outpatient arthroplasty preoperative teaching session. In this video, you will learn about your hip or knee replacement surgery. Please note that there may be some paperwork referenced in this presentation that you have not yet received. You will get all of this documentation when you come into the clinic. You may note that some of these slides have page numbers on them. These match up with the page numbers on your surgical booklet. Please feel free to follow along with your book if you have it on hand. Goals and expectations. Your surgery is a pain reduction surgery. You are not guaranteed to be pain-free, but we want to make you better than you are now. We want to improve your ability to perform your activities of daily living. You will not be able to run marathons or do high-impact activities, so you will be low impact for life. This means no running, no jumping, or any other high-impact activities. You want to protect your new joint, because if it wears out, you may require a revision surgery. There are movement precautions specific to each surgeon. You will be taught those while you're in the hospital. Your discharge is expected to be within 6 hours of surgery. Here is a list of documents you should have on hand prior to your surgery. These will be valuable resources pre- and post-operatively. Again, please note that you will receive much of this paperwork when you come into the clinic in person. Your teaching book, either a hip or knee book, the outpatient joint replacement surgical pathway, the pain management handout, the goals of care, also called the green sleeve, the scrub, your dental form. If you've not already completed that and had it faxed back in, we will need that before we can give you a surgery date, the outpatient surgical agreement, and the prescription form. For the hospital, wear loose-fitting clothes, stuff that's easy to get on and off. Please wear non-slip footwear and ensure that it is adjustable in case of swelling. Tie-up running shoes work great for this. Do not wear open-toed or open-back shoes, as those are a tripping hazard. Bring your crutches with you to the hospital. Your support person needs to be there, as they need to be present for the discharge teaching. Please also remember to bring your teaching book and surgical pathway document to the hospital with you to reference. Please note that AHS and Covenant Health are not responsible for any lost or stolen items. Surgery happens out of 3 sites: the Orthopedic Surgery Center, the Misericordia Hospital, and the Alberta Surgical Group, or ASG. Your team will provide you with your surgery date in advance, as well as its location. If you are being operated on at the Orthopedic Surgery Center, the hospital will call you the day before surgery between 4 and 6 p.m. to deliver your arrival time. If you are being operated on at the Misericordia Hospital, they will call you the day before between noon and 2 p.m. If you are being operated on at the Alberta Surgical Group, they will call you the day before. If they do not call you, please call the number for your hospital that is listed on this slide. These numbers can also be found in your surgical pathway document. Getting ready. To reduce your risk of infection, you will be provided with a pre-op skin scrub to be used in the shower the morning of surgery or the evening before. Instructions can be found on page 18 of your teaching book. Shower like normal. At the end of your shower, turn the shower off and use the scrub for 3 minutes on the surgical joint. This slide shows you where to scrub if you are having your hip or knee replaced. Then, turn the water back on and rinse off. Towel dry. 1 week before surgery, we want you to review your surgical agreement, which is the yellow paper filled out by the internal medicine doctor at your session, for medication instructions. It will tell you what you need to stop and when to stop it, as well as what you're allowed to take the morning of surgery. Fill the prescription provided for your preoperative and postoperative medications and arrange for equipment pickup. Make sure that you have what you need. The day before surgery, you are going to refer back to the agreement for any medications you're able to take the morning of surgery. Also take a look at your outpatient arthroplasty medication instructions that were filled on the prescription you will be provided with. You are going to take 81 milligrams of aspirin at bedtime, along with 1,000 milligrams of Tylenol or acetaminophen. Eating and drinking guidelines. Eating guidelines. We want you to stop eating at midnight before your surgery, as you will be the first or second case of the day. Please eat a final snack before you go to bed. either a piece of fruit and a cup of cereal with half a cup of milk, or a piece of fruit and a slice of toast with jam and half a cup of yogurt. Drinking instructions. If you are being operated on at the Orthopedic Surgery Center or the Misericordia, you are allowed to drink see-through, clear liquids until 1 hour before your arrival at the hospital. Examples of acceptable fluids are water, apple juice, cranberry cocktail, black coffee, or tea. Do not add milk or cream to your coffee or tea. Do not have any alcohol for 24 hours prior to your surgery. Do not drink diet, sugar-free, low-calorie, or energy drinks. If you do not have diabetes, drink 2 cups or 500 milliliters of clear apple juice or cranberry cocktail 1 hour before your arrival at the hospital. If you do have diabetes, drink 2 cups or 500 milliliters of water 1 hour before your arrival at the hospital. Remember, stop drinking 1 hour prior to the arrival time given to you by the hospital. If you are being operated on at the Alberta Surgical Group, no eating or drinking after midnight. In terms of follow-up after your surgery, here's what you should expect. The day after your surgery, you'll get a call from a nurse at the hospital to check in and make sure you're doing okay. 2 or 3 days after the surgery, you'll get a call from your case manager. Please note, you can also call your case manager at any time if you have questions or concerns. If they are unable to take your call, feel free to leave a message. You can also call the unit you were on if you have questions after hours. That number will be on the last sheet of your outpatient pathway document. You will also have a 2-week nursing follow-up. This will take place back at the clinic for people from Edmonton and surrounding areas, and will happen at a local hospital or family doctor if you're from out of town. We see everyone back at the 6-week follow-up. You'll see your surgeon and a physical therapist again. At 3 months, the physical therapist likes to follow up just to make sure that there are no issues. What to expect after surgery? Swelling. Everyone can expect some swelling. This is why we encourage elevation 2 to 3 times a day for 45 minutes each time. Make sure to keep your bed as flat as possible. Elevate your entire leg up on pillows, as is found in your book, so that your foot is above the level of your heart. Keep your knees straight. Ice for 15 to 20 minutes, or less depending on tolerance, at least 3 times per day. Cold therapy is highly recommended but not required. Breg cold therapy machines are sold at our joint assessment clinic, but frozen peas or corn or ice packs work as well. What to expect after surgery? Pain. You will have some pain after surgery. You'll be given pain medications after surgery. Make sure that you take them if you need them. If you wait too long, it can be very hard to control the pain. Everyone will have pain after surgery. Pain management is provided on the prescription we give you in clinic, which is to be filled prior to your surgery. Questions or concerns about that? Call your case manager or talk to the pharmacist about that. Complications after surgery that you should be aware of. Blood clots are rare, but they do happen. We try to prevent them from occurring by using blood thinners and encouraging mobilization. You have a blood thinner on your prescription sheet, but still watch out for signs of blood clots. In the leg, that's increased swelling that doesn't go away. Your leg can get red, hot, tight, and discolored, and you will have calf pain. If these occur, please call your case manager as you may need to go to the emergency room, or we can try our best to have you booked for an ultrasound to have that assessed. If not, we will be sending you to the hospital. Sometimes the clot can travel to your lungs. If you have any chest pain, shortness of breath, or trouble breathing, please call 911 as that is a medical emergency. Anticoagulants used after hip and knee replacements are surgeon dependent and a prescription will be provided. You will also receive an injection handout if required. Questions regarding the injections can be directed towards your pharmacist when filling the prescription or by calling your case manager. You will also be provided with injection instructions when you are discharged from the hospital. Another complication after surgery can be infection. Infection is rare, but it does happen. When it happens, it can be catastrophic. If you have any of the signs and symptoms of infection, you should call your case manager right away to have it further assessed if it is business hours. i.e. between 8 a.m. and 4 p.m. on weekdays. If your incision becomes red, hot, swollen, if there's any foul-smelling drainage or any drainage from your incision, if you have increased pain, fever, or chills, please call your nurse. If your dressing or bandage is not intact or is leaking, please call your nurse as well, as we can give you dressing change instructions. If you do have an infection, the earlier it is caught, the easier it is to treat. If you are concerned and it is outside of business hours, please go to the Royal Alexandra or Misericordia emergency rooms to be seen, as those are the sites where we do our joint replacements out of. Another issue after surgery is constipation. This is mainly due to the narcotics you're taking and your decreased mobility. On your prescription sheet, there are medications to help, and they are also available over the counter. We recommend Senokot and PEG. If there are other methods that work for you, such as fiber, fluids, Metamucil, prune juice, probiotics, etc., do that. Still having issues? Contact your pharmacist for recommendations, as they have easy access to whatever you may need. If you have any questions, please contact your case manager. The number can be found on the back of your surgical booklet if you've received that already. If you do not have their direct line on hand, please call our front desk at 780-433-3155 to be directed to your surgical team. Your in-person teaching session allows us to measure you for the equipment you will need for surgery and ensure you have a plan for who will help you once you get home from the hospital. For now, here is an overview of the information that you will need to know for preparing and recovering from surgery. These are the expectations for people having a joint replacement with same-day discharge. First, practice your home exercises and walking with your crutches daily until surgery. Have your recommended equipment set up in your home before your surgery date. This will allow you to have a safe return to home on the day of your surgery. Your driver needs to be able to pick you up within a few hours of your surgery. This time will be discussed with you when you check in for surgery. The exercises are found at the beginning of your teaching book. Practice these exercises before surgery to get good at them, as these will be your exercises for the first 6 weeks after surgery. Move through the range of motion you have and work up to 10 repetitions. If you can't tolerate sets of 10, decrease the number of repetitions until you can tolerate them. Remember, quality over quantity. At your in-person teaching visit, we will size your crutches and teach you to walk with crutches on flat ground and on the stairs. Surgical patient agreement. A summary of what you need to do before surgery can be found on your surgical patient agreement. If you are watching this from home, you will receive this when you come to clinic. This will tell you about what equipment is recommended for you and where you will source it. The last box will remind you of what to bring to the hospital with you. As you will be going home the same day of your surgery, this includes your walking aids. If you require dressing aids following surgery, these will be listed on your Allied Health Surgical Patient Agreement as well. We can provide a list of vendors to purchase equipment and video links regarding dressing aids and bath equipment for your reference. You are recommended to use crutches or a two-wheeled walker for the first 6 weeks following surgery. If you are having a direct anterior or other minimally invasive hip replacement, you may be progressed onto a cane earlier than this. Tub transfers. Keeping the surgical leg clean decreases the amount of bacteria on the skin, which can help avoid post-op infections. You will bathe sitting on a chair in the tub or in a walk-in shower to keep you safe from slips and falls. You will not be allowed to submerge the incision area in a tub, pool, or hot tub until this is cleared by your surgeon, which usually occurs around the 6-week mark. You can decide which cold therapy option works best for you, but be prepared to use the cold frequently for the first month or two following surgery to help control pain and swelling. If purchasing a cold therapy machine, become familiar on how to use it prior to your surgery. AHS provides some funding at contracted physical therapy clinics. To utilize this funding, you have until 12 weeks after surgery to start physio. You do not need to attend physio at these clinics. If you prefer to go elsewhere, you can utilize your private benefits or pay out of pocket. Driving. It may be up to 6 weeks before you could drive. Issues that arise with regards to driving include the use of narcotic medication, range of motion and strength of the surgical leg affecting reaction time, your ability to walk normal distances within a parking lot to get where you are going, and your ability to load and unload the recommended walking aids. Your ability to return to driving will be assessed at your follow-up appointments. What should you expect after surgery? Even during a good recovery from surgery, you will have pain, swelling, and bruising. Use your cold therapy and medications to help manage these. You can offload more weight onto your walking aids to decrease discomfort. Avoid prolonged periods of time on your feet, as these can contribute to increased pain and swelling. Exercises may be difficult. You will need to work on exercises from your teaching booklet or from your physiotherapist to regain mobility, strength, and function of your leg. You will need to delegate activities around your home while you focus on exercise and pain control strategies that are needed to get a good outcome from surgery. The majority of people are off of work for 3 months following their joint replacement surgery. After joint replacement surgery, you will be considered weight-bearing as tolerated, which means you can put as much weight through your surgical leg as you feel comfortable with the remainder of your weight being divided between your arms. Using the crutches or a walker allows you to more comfortably tolerate the discomfort that comes with joint surgery, as well as minimizing the risk of falls. Your crutches will always stay with your surgical leg. When you go upstairs, the strong leg goes up first to lift your body up a stair, followed by the crutches and the surgical leg. The reminder is the good goes up to heaven. When you go downstairs, the crutches and the surgical leg are lowered down onto the lower step by the strong leg. Then the strong leg descends onto the same step. The bad leg goes down to the other place. Our allied health team members will review crutch use with you when you come to the clinic to be seen in person. Each of you will practice using your crutches as well as doing a flight of stairs with your crutches. Thank you for taking the time to watch this video. If you have questions for the Allied Health Team, you can get in contact with them at 780-377-1432 or 780-377-1431.